Hello, and welcome to the Simply Business Interview Podcast, a podcast created by business owners for business owners. I am your host, John Jennings. I believe that most business owners are working way too hard for much too little. And one of our issues is that we overcomplexify things. I believe the answers are almost always within us or within our reach. I like to say that I'm a simple man with simple ideas. So welcome to Simply Business. All right, I'm really excited about today's interview. I've known this man for probably, 10 years or so in and around the Louisville healthcare market as I've dabbled here and there. He is a fixture in our entrepreneurial area, and he's got a great story because it hasn't been all easy. He's in the thick of it, and he's had failures and he's had redemption, and it's kind of, it's just one of those interesting entrepreneurial stories. And I find those inspiring. And he's also, he's trying to solve something that's probably the most complicated, the most broken part of a broken system in healthcare. So John Williamson, welcome to the show. Really looking forward to catching up with you, hearing what's going on. You are the founder of Lockbox AI. So why don't you take it from there, introduce yourself, and tell us a little bit about what you're doing right now.
Yeah, John, thanks for having me. I appreciate it. John Williamson. I've been a bit of a serial entrepreneur, and I've been focused in the healthcare revenue cycle space for about the last 12 years, sort of with my first real job back at Zermed, now called Waystar. Then built a small company doing revenue cycle automation. As soon as we sort of hit the middle of the target, COVID hit, and we had to sort of scramble and had to sell that company pretty quickly, the assets of it. Then started this company, which is kind of a version 2, focused on the healthcare revenue cycle and being able to explore and present data, drive workflow, and drive automation, and bring that all together to lower the cost of collection and decrease denials and decrease FTE costs, sort of all the things that go with that. So I've been focused in the revenue cycle industry for a little bit now, and it's a messy part of a messy industry, and I think honestly that's sort of the challenge that keeps me really motivated to stay in this space.
Yeah. Well, and and no offense to accountants or landscapers or people who have a talent and say, what, I'm gonna start a business and something that I'm good at. There's not a lot of new under the sun there, right? You're kind of, but you're in an industry that has gone through tons of change. Everybody's trying to figure it out. I think everybody wants there to be an answer, but there just doesn't seem to be an easy one. So why don't you first just kind of do a little bit of remedial stuff for those of us who aren't revenue cycle experts. Give us kind of the I don't know, the 6th grade version, if you will, the RCM for dummies, I guess. A little bit of an overview of what this industry is about.
Yeah, well, it is messy, and U.S. healthcare is messy. We all know, we've all engaged with a healthcare provider at one point in time or another, whether it was as simple as the urgent care clinic or primary care, or worst case scenario at the ER or an inpatient stay. We've seen it. We've received the bills that we don't understand. We receive these giant stacks of paper that say this is not a bill, which is also
Right.
confusing. And then eventually we do get a bill, which is equally confusing. And then it's for some ungodly amount of money. Sometimes not. Really depends on a lot of things. I've had some experiences myself where we've gone into a facility where our insurance covered it, and then we're seen by a doctor who apparently wasn't on our insurance, but we didn't know. And then the bill we got was, for the out of network rate, which is just ridiculous, sort of top
Right.
line price. And I've been through that a bit. A lot of people have been through that and really been bankrupted. I think the
Mhm.
stat that I heard was 50% of all bankruptcies are related to medical debt,
Yeah. Yeah.
which is horrible. And you know, it, it has a lot to do with the complexity and the competing, financial interests in the market. So you've got, the provider who's trying to maximize their reimbursement. You've got the health insurance company who's trying to minimize the amount of money they lay out.
Yeah.
And the insurance company is more well equipped in this fight. There's fewer of them and they have more money and more tools at their disposal to set up tripwires. Whether the tripwire is, you something simple where the provider made a mistake, like, oh, it's January and you have a different insurance you did in December, and I forgot to check that. That's one kind of mistake. But now there's a lot of new ones. You hear about prior authorization, which didn't used to be as
Right.
big of a deal. Now they've realized from an insurance company perspective, if we prevent you from getting a service until you get authorized, that'll dissuade you from getting the service. And some other set of time, the provider will do it without getting the authorization, and then we don't have to pay.
Mm.
And then there's, recommendations to specialists and referrals and credentialing and enrollment and all these things that the doctors have to go through to make sure they're sort of following all the criteria of the insurance company. And
Mhm.
then you throw in that the change in our coverage. So as employers, the health coverage care costs are going up, 5 to 10+% a year, never ending. And it's just compounding. And so it's really painful. So what they've done is they've turned to high deductible plans. And so
Right.
now you got a 1,500, 2,500, maybe $5,000 deductible, family even higher than that. And so the amount of money that's being spent, the first set of dollars is by the patient. And
Mhm.
so there's even more incentive to buy, both insurance and providers to sort of get to the insurance payment side of things so that the doctors are sure to collect because they only collect about 50 cents on the dollar from patients. So you
Oh
got to
wow.
imagine that the amount of money they collect when the patient's high deductible plan, there's 50% chance they're not going to collect what the bill they send you. So there's
Hmm.
all these dynamics going on. And revenue cycle starts, there's sort of depending on how micro you count the steps, 15-ish steps from checking insurance, checking benefits, maybe doing authorization, taking the doctor's notes and coding them into a claim with diagnosis codes and charge codes, to checking documentation to see, did you document the things properly? So, for example, if you go into the doctor and he runs a test, orders a test, but he doesn't make a note in the EHR that you needed the test or why you needed the test or said some kind of buzzword essentially,
Right.
then when the health insurance company says, send me the medical documentation before I pay this, they now scrub it with an AI to see, oh, you didn't say the buzzword, we're not paying for it.
Right.
So there's this clinical documentation improvement step that's just checking the documentation of the doctor, which is half the time why they're staring at the computer and not you when you're in the doctor room.
Yeah. Yeah.
There's billing, getting the claim out the door, and the payers have all these extra rules. So you go to this plan, this commercial plan, Humana this over there, Aetna that over there, Medicaid over here, Medicare traditional, now a bunch of Medicare Advantage plans. And
Mhm.
those plans, which are derivatives of the Medicare plan, they introduce extra rules, extra
Right.
fees to try and avoid payment. So you end up with even more sort of scrubbing that you need to do before you send the claim out the door. You send it off, you send it through this middleman called a clearinghouse, which Waystar here in Louisville is one of the big ones.
Hmm.
Then ultimately gets it to one of 5,000-ish total payers, insurance companies. You may only know the name of five of them, but there's actually about 5,000 if you
Oh
include
wow.
these small health plans. They all
Mm.
have different rules. They had to get the claim out the door. Then somebody from the provider needs to make sure, well, did I get paid within 3 weeks or so? If not, I got
Mhm.
to call on that. Or maybe I got a denial, which happens 15 to 20% of the time, sometimes more, where they're asking for more information. No, you didn't authorize this. And now I've got to have at the provider level, go fight for that claim.
Yeah.
So, and I may only be fighting for a very, very small chunk of money. So you get this, $5,000 claim that goes out the door. Well, only $1,000 is authorized, and half of that was denied. You're fighting for smaller and smaller chunks of money.
Oh wow.
You finally get that in. You got to record that payment and all the adjustments and denials and all that messy stuff that you see in paper at home. You got to record that. And finally, you've got insurance taken care of. Sometimes there's secondary insurance. Then eventually you can bill the patient.
Yeah.
And by eventually, I mean it could be 3 months from now, it could be
Yeah.
literally almost a year from now. And the
Right.
likelihood that the patient pays goes down every month that it takes to get the bill to the patient out the door for whatever
Sure.
they owe. So it's just long, long process with so many steps that have so many landmines in them that it creates a real challenge for providers to manage their own revenue cycle. So a lot of those folks outsource to firms that specialize in doing revenue cycle on behalf of multiple providers, whether
Mhm.
that's a hospital at the high end or a clinic at the low end. So
Yeah.
you've got an entire industry that is built around getting claims, you know, scrubbed, submitted, collected, posted, payments from the patient collected upon when they don't pay. You've got a ton of folks that are working offshore. So they actually have, this is interesting, they have degrees in college in India on US healthcare billing. In the United States, we do not have degrees for
Yeah.
US healthcare billing. They actually have degrees in India and Pakistan and the Philippines for US healthcare billing because there's literally hundreds of thousands, probably millions of people working in the revenue cycle industry in India, Pakistan, Philippines, because it's too costly to throw enough labor at it in the US. That's how
Yeah.
crazy it is.
Yeah. So, yeah, this, you basically just, you know, just that description alone just shows how messed up this is. And, you know, I guess the easy answer easy in air quotes is, well, let's just go to a one payer system and let's just, take all this stuff out. And maybe that in some ways that would probably reduce the cost. Um, but yeah, this is uh, it's a byproduct of what we've created, which is this crazy healthcare system that's employment based, which is also one of the
Yeah.
kind of unique things about our system, um, and and it seems to be manufactured to be complex so that people won't question things.
Yeah.
Uh,
That was I remember, I'm not sure if it was in the movie The Big Short, but it was sort of during the great financial crisis where they sort of went back and looked at all of the nonsense that had been created around, credit default swaps and CDOs and synthetic CDOs and all this nonsense. And the whole thing was designed to be complex because wherever there is complexity, there's opportunity.
yeah,
And all the players who are aiming, angling for their slice of the pie are all fighting each other in a battle. And everyone knows that the more complexity there is, the more sort of battle fronts there are, the more
yeah.
opportunities there are to, consultants and specialty services and, all this stuff. It's
But what
wild.
would you estimate the global um, size of the RCM industry alone? What do you think it is?
It's several billion dollars. How many billions? I couldn't tell you exactly. Sort of north of $20 billion, most likely.
Wow.
Um, Now, there's revenue cycle, which is the name that we give it on the provider side, and then the payer side, where they do adjudication. There's
Mhm.
there's a parallel mirror industry on the payer side that is receiving these claims, scrubbing them with software, routing to humans,
Yeah.
doing audits to try and recover money from the
Yeah.
past, and everything's
That's what we call subrogation, right? Is
well, and
that an aspect?
subrogation is actually a subcomponent on the payer side.
Okay.
But there's so many layers of components here because there's
Yeah.
so much money at stake. I mean, the U.S. healthcare, is like a fifth of the economy, and
Right.
which makes no sense. It should be 10% of the economy, 11% of the economy. In other nations, that's what it costs. But there's so much profit motive from all angles, it sort of raises the price on everybody.
Wow. That's crazy. So, other than being a narcissist or something, or just a glutton for punishment, why why this industry for you personally?
Well, I didn't know anything about it. I have been working in sort of software product development since college and got the bug for sort of B2B online software before they called it SaaS. I think my first project I did was back in 2004 for a truck driver onboarding training thing, which had
Mhm.
multiple players in multiple places and different businesses all needed to work together in sort of a secure, access controlled way. And it was a complete mess. And I got brought in as a small software development company to go figure out a solution. And those were the early days of software on the internet. And so not downloaded software, but true sort of what you now expect software to be, which is on the internet. It didn't used to be like that. It was just turning at that point in the early 2000s for where this was possible. And so you could do, what I call multi-party workflow collaboration. So you've got different entities in different places doing different things, sort of all hitting the same, set of data, but from their own angle, limited to what they were allowed to see.
Yeah.
And that really taught me the value of this kind of system on the software designed for multiple layers of interaction. And I sort of designed and built a number of systems over the course of the years. And then in 2013, got my first job, so really jobby job kind of thing,
Hmm.
non-entrepreneurial, non-consultant job. Uh,
Yeah.
and I really had to learn the deep end of revenue cycle, and I didn't know anything about it, so I went in very naive, but I had learned the technique of going and sitting next to people who did work and watching them do work and ask a ton of questions and sort of be open to all new information and repeat back whatever connections I was making to say, okay, so I understand this and I understand this. Are these how these two things are connected? No,
Right.
there's one other step. I didn't know about that. Interesting. And I kind of kept doing that. That's always been my nature to sort of reverse engineer and figure out how complex processes work to come up with a solution that was workable. And
Hmm.
one of the things that has been so, you know, interesting and challenging is that the industry isn't even the same across different settings of care. So the way
Right.
hospital revenue cycle work is different than the way primary care works, which is dramatically different from the way home health and hospice works, which is different than specialty DME. All these entities come at it from a different angle. It's maybe 80% the same, but 20% unique. And
Right.
so the sort of challenge of designing systems that surface data and allow for discovery of important information and facilitate workflow that is different in different environments and where the underlying data is 20% different at underlying environments and the constellation of systems in place. So all of these folks have what we call EHR or EMR, electronic health record, or
Right.
electronic medical record. People use different names, but those systems, plus clearinghouses, plus all the insurance portals online, they all have to be connected and working together. And every client has a different constellation of those systems.
Right.
So there's lots and lots and lots of variables here. So the sort of challenge of designing sort of productized solutions that are, rinse and repeat with minimum customization per client, that challenge has been, I sort of jokingly call it, it's been my muse, over
Yeah.
the last 12 years. And it's it's a complex Rubik's cube, but the complexity of it is what keeps me motivated and interested. Um, there are certainly easier things to do. Some days I question whether or not why the hell am I in this industry? And, other entrepreneurs will say, well, you know how to do all this stuff. Why don't you come over and do something simpler that
Yeah.
do faster? So, it's a good challenge.
Yeah. Well, certainly seem to be up to it. You're obviously a very intelligent person. I've always been impressed because you rattle all the stuff that most of it just goes over my head. But I understand enough to know this is it's just extraordinarily complicated. So I am a big lover of AI. I was an early adopter. I mean, I was one of the people signing up for Chat GPT the moment it came out. I use it and other tools all the time, and for business and personal and all sorts of things. But um, implementing AI, I'm an old software developer myself, but we didn't have these tools then. How much fun it would have been, I imagine. But what is the AI component of your solution, and how are you trying to leverage this new technology to answer a complex problem?
Yeah, well, we've done a couple different things. So in the very beginning, we started in 22. I sort of started creating the MVP, and initially, AI at that time was not generative AI. That was just at the end of the year. Generative AI came out. In the beginning of the year, that didn't exist, and it was all machine learning, predictions and using algorithms to predict, based on these inputs, here's what's most likely to be this output. Could I predict a denial? Could I predict the
Right.
type of denial based on payer and codes and doctors? those kinds of things. Um, that was the original.
Yeah.
Then, sort of in version two, which we're kind of on our third version we're going into right now, but on version two, we did some experimentation with generative AI to say, okay, I'm going to present you with we take in data from these different data sources. We'll take in 100 fields of data. We'll generate another 100 fields of data based on sort of a rules-based engine that labels things and calculates things. And so now we got a couple hundred pieces of data that, how do I summarize that in a way that's intelligible for a worker coming in and looking at the claim or the file for the first time? So we tried that sort of, can you take a subset of those 200 fields, summarize it together in something that is helpful. And at that time in 23 into 24, the we were using some of the open source Llama models at the time
Mm-hmm.
because you didn't want to pump healthcare data through ChatGPT based API. That was sort of unclear whether or not that was going to even comply from a HIPAA perspective. So you had to host
Right.
your own model, which meant at the time, I think Llama 3 or whatever.
Yeah.
And then the reality was that a skilled worker entering a claim that was sort of already sort of pre-grouped together knew what to look for better than the AI did, and that the
Hmm.
summary wasn't helpful. And it really didn't add
Interesting.
enough. I mean, to a layperson, oh gosh, that's neat. It just gave me 2 sentences to tell me the status of the claim, but it didn't actually help the worker do their job faster. And so
Hmm.
that was kind of a surprise. We thought, oh, well, look at this clever
Yeah.
use of generative AI, right? Um, so that wasn't as helpful as we had thought it would be. Our new version, where we sort of had a version two, which we're rolling out, and we service providers, and now we're servicing more revenue cycle billing companies, which they have many clients. So every rev cycle company has 20, 30, 110 clients. And,
Right.
and so the amount of data we're processing is going up, 100x, 10x, 10x to 100x, because each client we serve has multiple other sub clients.
Right.
So we needed a system that could scale faster and run all of that more performantly.
Mm-hmm.
And one of the things that we discovered during the flow, and which we'll be implementing here shortly, which is it's actually not going to use generative AI. It's actually going to essentially do an on-the-fly machine learning cluster analysis. So one of the things that
Okay.
happens, let's say you're in a meeting. So our software facilitates human and bot workflow to make the sausage, but you got to present. So our clients now, most of them are billing companies that present to their client on a monthly basis, right? So we're generating all the analytics to present, which we've refined and refined and refined based on feedback. But you see something you don't like,
Mm-hmm.
and the client, the provider group, what the heck is that? Tell me more. Why is that happening? Really, the answer why. They can see the what. They want to know why. Well,
Yeah.
normally that's difficult to say because, well, there's a lot of variables and it's this combination of codes at this location with this payer, and it's only since this last 2 months. How do you figure that out? And so in normal analytics land, well, let me slice by this and slice by that. Now that bar is higher over here. If I click over here, that other bar is higher. I wonder which one goes with which thing.
Mm.
So what you want to be able to do is an on-the-fly machine learning process to go find the cohorts of combinations of data that are actually the root cause of this thing. So
Wow.
some on-the-fly machine learning. So I navigate and filter analytics mode, and then I want to say, show me why. And it's got to go run for, seconds to a couple minutes in the background to say, okay, here are the most common combinations of variables that have the most influence on the thing that you're highlighting.
Mm-hmm.
There's that component. Another component we'll introduce in 2026, we need to speed up the workers. So it's all about reducing the amount of hours and time spent collecting on a claim that needs touching. It needs to be worked, whether it's a phone call or going to check a payer portal. That's really our mission: is delight clients with analytics, help answer the why questions, help make the sausage making more efficient by implementing automation and making your workers more efficient. One of the things that, you know, typing is actually much slower than talking is. So
Yeah.
as a revenue cycle worker comes in, one of the things that you don't get, and we host all these, people's notes and annotations, and you think we could easily reverse engineer what did this person see that led them to do this action. That's really the correlation you want to make. But you only get the minimal amount of information because they had to type it in. So
Yeah.
one of the things we'll roll out in 2026 is essentially voice mode, which will
Mhm.
use a generative AI to, transcribe what they
Right.
say and fill in a more robust description of what are they doing and why.
Yeah.
And from that, we can harvest, okay, well, anytime they see this, they're also looking at that, and then they do this.
Hmm.
So that's sort of using it there. Those are some use cases that we're currently working through. We do a ton of rule stuff still. I mean, a lot of our engine is rules based, and
Yeah.
we label and categorize things based on rules because it has to be consistent every time.
Yeah.
And one of the challenges has been you ask the same question twice, you get two different answers. In a
Yeah.
generative AI space, which we use generative AI a lot. But that is a problem when you want to incorporate it into a structured workflow.
Yeah.
So anyway, those are some things. But now I will tell you on how we're using AI that has been really exciting and really revolutionary for us. So earlier this year, we got on the using Cursor AI, which is one of the development tools that are out there.
Hmm. Yeah.
And we discovered something. At first, we were using it like everybody uses it, which is oh, I can like hit tab and it'll sort of write the next line of code, and that makes
Right.
everybody incrementally more efficient. But then we discovered, well, if you actually, instead of maintaining and incrementally doing improvements on software that you already created, if you rebuilt that module with the AI tool from the ground up,
Yeah.
you would build it completely different.
Yeah.
And I have to give full credit to our CTO. He sort of, took the bull by the horns and is really on the frontier right now. And in the last, since sort of Q1 or, late Q1 of 2025, we have been redeveloping our platform from the ground up using an AI first strategy, the highest quality, enterprise grade system I've ever been a part of, only
Hmm.
and generated, you know, we cut our team a fair amount because honestly, we didn't need that many engineers. One of the things, big lessons that we learned is that a junior to mid-level engineer is completely not useful in this environment.
Yeah.
There, this is the unfortunate. This is sort of the front line of job displacement. Maybe other than like
Yeah.
customer service reps. This is the front line that we're involved in that we see very directly. That one senior level developer doing ground up development is 100 times more effective and efficient than a mid-level, someone who's been working for 5 to 7 years, much less a newbie, which has, you can't even play the game.
Yeah.
But even an moderate level person that doesn't understand all of the whole system and how all these different things work together can't get nearly the effectiveness out of these tools
Yeah.
that a senior level person can. It's really
It-
been mind blowing.
Let me play that back to you and see if I've heard this before and I've seen it. Uh, a If you think of traditional development, let's say I train or I give a new tool or a new package or new platform or just train my people to be better at X. If they're a low level person and let's say they get 20% better, they're 20% better. If they're a mid level person, they get 20% better. It's still they get even a little more better, and then the top person 20% better is up here. But when you do this AI enablement in the development platform, what I'm sensing, what I'm hearing is it's not a 20%, it's now an exponential kind of thing. And so, you know, 2 to the exponent of 3 is only 8, uh, comparing an entry level person to say it to 2. But let's say a, uh, a developer, a senior developer who's 100 to the third power is whatever that is, a million or whatever. It's
I'm
just
glad
a
you're doing the
lot.
math there.
Yeah, I'm not. It's Friday. I'm not doing math on Fridays. But the point is, it's just mind blowing the capacity to someone who's really good with the right AI tools. I mean, it's mind blowing how much they can get done now.
Yeah.
Yeah.
And it really wasn't until we did a greenfield module. It was almost by accident. We were planning on incrementally updating this and that and whatever. Until we did a greenfield, a net new module, AI first development that we discovered, holy cow, maintaining legacy software, the opportunity cost of maintaining legacy software, even using an AI tool, um, you could be 20% more efficient at maintaining old code, but that is nothing compared to what you can do from the ground up,
Yeah.
which that was a big turning point for us.
Hmm.
And I think, I mean, some companies had discovered that, probably, 9 months earlier, and the tools got much better in the interim. So you could have now in the software environment, because when you write the code from the first line of code up, you're building test cases and you're building all these components and rules and blah, blah, blah in it, so it has its own training data. It's sort of feeding on itself. So the prompt engineering that you always hear so much about,
Yeah.
its prompt is self-prompting based on all the sort of very robust code it already wrote. So it's got more to lean on versus
Yeah.
when you try and stick it in existing software that's not well commented, that doesn't have good test case coverage, all this stuff. And that has really, you end up producing much, much higher quality code. Yes, because it's a good idea, but more importantly, because it's the high quality, well commented code that allows the AI to be that much more effective. So you
Yeah.
end up building higher quality stuff faster with far fewer people. That's the net of it.
Yeah. Fascinating. Let's change the topic a little less technical for so a relief maybe for some of some of you listening. Uh, let's just talk about just the concept of being the business owner. What was you moved? You spent a short time in corporate. I spent decades in corporate. Uh, so there was like this culture shock when I moved over to to the entrepreneurial world. But you still spend enough time in some corporate to get a feel of that. I'm hearing more and more from the entrepreneurs I talk to is like I just had to get out of that. And so, uh, what what was the biggest surprise to you coming from a corporate role into an entrepreneurial kind of role? If you can think back to 6 or 7 years ago when you first did that.
Well, and I kind of sandwiched. So I was already doing my entrepreneurial stuff before, and then came in. And when I came in, I got very lucky to work with a great group of people. I still love those people, and got assigned a net new project. So I
Mm,
wasn't doing maintenance, incremental improvement stuff. We were doing something new, which was where I fit the best,
mhm.
because I had to do the customer discovery and talk to the build consensus and figure out all this stuff, right? Um, which is very similar to what you do in an entrepreneurial world, right? So I was sort of well positioned as a product manager, which is sort of the most entrepreneurial role in a company, a software
Yeah,
company, to do not project, which is not entrepreneurial, product
right.
management, which you really do. You kind of become the nickname is you're the CEO of that product.
Yeah.
You have some decision making capabilities. You got to. No one officially reports to you, but you've got to sort of get everybody rowing in the same direction, which is very similar to a startup. So I
Mhm.
was well positioned there. I got lucky to be put in that position and put on a new project, and given enough sort of rope to make things happen without, getting too many people upset at me, right?
Yeah.
And sometimes I would find myself making an assumption that if we needed to do something or, pivot this, 20 degrees to the right, no big deal. We just say it and do it. Oh, wait a second. We got to talk about it. Let's have a meeting about that. But in
Mm,
my mind, we had already made that decision. So why are we talking about it?
yeah.
So that part there was, a little bit more meetings, more people, more stakeholders, more people needed to nod their head, but
Right.
it worked reasonably well. So I didn't probably have the worst case scenario version
Mhm.
of corporate. I had probably the best case scenario, and still enjoy that very much. But I like taking responsibility for things. I like being in the position to make the decision on what we need to do, and if we need to change decisions with as little, friction as possible.
Mhm. Okay. So, what from a leadership standpoint, a people standpoint, what are a couple of the challenges that you have to wrestle with in a in a smaller entrepreneurial company? What are some of the things that challenge you from day to day?
Yeah. We've been remote first from day one. We started during COVID and folks are just spread out, right? So it was
Yeah.
always no question remote only. Um, so keeping people on the same page can be more challenging in some cases, but can be simpler in others. Um,
How
that
so?
well, more challenging because you're not all in the same place, but
Yeah, I
less
get that part.
challenging
I
that,
want to hear the less challenging part.
yeah, you don't have to sell people on making a change as much.
Hmm.
So if you wanted to, you know, make an important decision, you don't have to spend as much time, let's call a meeting, let's have everyone get the refreshments ready. Okay, we're going to talk about this thing. I want to hear everybody's feedback and, yada, yada, yada. And a big decision is a big painful thing to do. You can sort of be in quote founder mode, where you're
Yeah.
going to make a decision because it's the right thing for the company, even if it was a tough one.
Yeah.
It could be a bunch of different things are tough decisions that are going to impact, everybody in every way. I think in some ways that's a lot simpler to do in a smaller environment. It might even be slightly simpler to do yet in a remote environment, because there's just less water cooler talk on
Hmm.
second guessing everything, or side conversations trying to pitch you this or sell you that or dissuade you from this or encourage you to do that. There's
Yeah.
less of that. um,
Right.
so that's the kind of better part. The worst part
Yeah.
is you're not together and you got to make more effort to stay close. But yeah, that's what I
Yeah.
think.
I fear that's where you're going, and that is interesting because there's something about mob dynamics, right?
Yeah,
When you get everybody in a room together, yeah. So I can kind of understand that you were able to uh, inspire on a one-on-one level a lot more, probably
yeah,
because they're already almost most of the conversations are one-on-one.
yeah.
So what's next for you guys? I mean, you're in the midst of rollout, so I know you're still kind of in founding stage, but where do you see this going?
Yeah, so our strategy has been, and we're taking a little bit longer than planned to do it, is to get early product market fit and then exit to a larger entity that, private equity or a strategic purchase, whatever it might be, where we can deploy inside of a portfolio and then grow from there.
Mm,
Because truth be told, to go raise enough money to go hit this market at scale is
mm,
difficult, and we're not in the
yeah,
best place. And I've got little kids. I'm not going to run up and down Sand Hill Road, and I don't want to do that. You
yeah,
can. It is a very high risk gamble to go raise eight-figure sums of money
yeah,
and try and be a self, be a standalone company to get to scale,
yeah.
especially when the decision cycles in this industry are notoriously slow.
Oh yeah,
People are risk averse. So the last thing they want to do is take a chance on a small startup company with a big contract. So you're only going to win small to medium sized contracts as a small company. So in
yeah,
order to sort of get to break even or profitability in this industry is particularly difficult. There's regulation, there's audits, and there's security stuff, all this extra work you have to do, and extra
yeah.
expense you have to do. So it's difficult. So we're in the what I would say the last stage of our first chapter, which is to get scaled product market fit and an enterprise grade product. So we're getting early product market fit. That's good. Our sort of hardened enterprise grade version of our system that can handle scaled growth is coming online this year. And we feel good about that. And so we're, having some early conversations. We'll have some more for the next phase to go find sort of our new home. So
Mhm.
just our team will roll with it. We'll still grow
Yeah,
organically, plus we'll implement in portfolio, and maybe implement some interesting
yeah,
strategies in growth.
yeah. Makes perfect sense. I mean, you're in an industry that, like you said, $20 billion industry. It's hard to crack it, make a significant impact unless you've got a lot of money behind you. And
Right,
so,
right, exactly.
so, well, this is fascinating. I've learned a little. My head hurts a little bit. I'm gonna have to go think about that. I'm gonna replay this on. I'm gonna usually I listen to podcasts on 1.5 speed. I'm gonna have to take this one down to 0.75. There's so much in this, but I always, especially for the entrepreneurial guests that I have, I love to ask the question: just what advice would you give that aspiring, young guy out there, young gal who's maybe thinking about doing something, maybe not near as complicated as what you are, but just looking at maybe taking an entrepreneurial leap? What advice do you have for
There's you got to love, you may not know what industry you're going to be in. And usually the industry you should be in isn't even one you're thinking of. Who thinks
them?
who thinks of any of this stuff, right? It's the more niche, the better.
Yeah.
You got to fall in love with the customer and with the problem, not the industry. So
I like that.
a sexy industry has a lot of people floating around and not too many winners. A non-sexy industry and a niche of a niche, that's where you can, if you can go learn, from prospective customers, exactly what they do, how they do it, and where their challenges are, you can find something to build a business off of. You've got to both be a good listener and a good question asker, and sort of question, well, why do we do it this way? And does it have to be that way? Sometimes it does. Often it's just sort of pattern matching. But I think you fall in love with the customer and the problem. Who cares what the industry is? Really, who cares? The less sexy it is, maybe the better.
Yeah. That's great advice. And I haven't quite heard it put that way. And I appreciate that. I always love nuggets like that. So John, thanks for coming on the program. Best of luck with what you're doing at Lockbox AI. And I hope that you just have a revolutionary impact on this industry, because it needs it badly. Because I don't think we're going to go. I think we're stuck with what we have for quite some time. So let's hopefully figure it out. And appreciate having really smart guys like you who are trying to do so.
Yeah, appreciate it, John. Thanks so much.
Thank you for listening to today's episode. If you liked it, please share or like it on whatever platform you use. You can find me on social media. On most platforms, I'm John K. Jennings. My first book is also available. Your Baby is Ugly tells you about 10 truths that business owners need to hear, but often won't, and how to overcome them. You can find it on Amazon. Just search for Your Baby is Ugly. And be watching for our next episode, where I'll interview another business owner who will share their stories and insights into what it's like to create a great business.